So we're with Dr. Garbus here in his practice in Santa Clarita. And one of the things I think that really differentiates him, besides for his awesome glasses and demeanor, is his enthusiasm for his toys. Dr. Garbus loves his toys. So Dr. Garbus, this right here is an OCT.
OCT, yes.
And then we have a retinal camera.
The retinal camera is here.
That's a camera. Kind of see that big
And
camera in the back.
This is a picture of the retina.
There you go. And then this is a topographer.
Corneal Topographer.
And this is used for fitting of specialty lenses, sclerals, hybrids,
And myopia control.
Yep, and ortho-K lenses. And this is a Sightsync,
Which we use to determine how well does the patient fixate on a target, both distance and near, how accurate their eye alignment is.
Nice. And then over here we have a virtual reality visual fields.
Yes.
Visual fields of the patient. And what other devices do we have?
Well, we can go into the VEP.
Let's go see it.
All
All right.
This is our VEP.
All right, the ERG VEP.
Yeah.
All right, while we're waiting, so the VEP ERG is two separate kind of uses. Okay, so they're both using light.
We're measuring
radio.
brain waves. Actually,
Right.
They're looking at a monitor
actually-
that flickering,
Right.
and it goes through the visual system into the back of the eye.
Right,
And it
that's VEP.
yeah.
Right. So it's measuring, so it's pulsating though a flash of light, and then it's measuring how your brain
We're
is.
measuring the response from the stimulus, the light stimulus.
Right.
So the stimulus can be the strength of the stimulus, or what the brain records in the occipital lobe as far as the strength. We call that the amplitude.
Mm-hmm.
It can also record how long did it take to get from the presentation of the stimulus to the recording in the occipital lobe, that time frame. So that's called latency. So that's measured in milliseconds, and the other one's measured in millivolts.
And so then there's basically a set number of time and.
So we work with averages, what the average time it should take between the presentation of the stimulus and the recording of that information.
And that can show you kind of, is there a problem?
Yeah, so if there's an optic nerve, say damage to the optic nerve, it can slow down that information getting to the back of the eye. There's an example would be in patients who have multiple sclerosis that has affected the optic nerve. It affects the nerve sheath. It causes damage to the nerve sheath, which is what helps to conduct the impulse from the eye to the brain. Mm-hmm. And it slows down the information getting back to the occipital lobe. So the latency time would be increased in, say, an individual had that kind of a problem.
Interesting.
Yeah.
And then for somebody who has like ocular diseases like diabetes or glaucoma, is the VERG portion of this used for that?
Yeah. So again, now we're talking more on the retinal level.
Right.
And the ERG will pick up the strength of the response in the retina. Okay. So now this is retina recording of energy, how much response there is, and timing. Okay, so there's a correlate. When you talk about ERG or you're talking about VEP, they're both electrodiagnostic tests that are measuring how efficient the nerve cells are firing.
Just where you're testing that efficiency, like exactly. Is it to the retina or is it to the cortex?
Or the cortex, right.
There you go. Got it. Okay. And is this used at all for macular as well, or is not so?
Yes. Yeah. Oh, yeah. This is definitely used for macular. The ERG is.
Yeah.